Hello everyone. Today we are going to talk about abdominal aortic aneurysm. Did you know that the aorta is the largest artery in the body and can make a bulge or swelling in many parts of its course for various reasons? The swelling or a bulge in the abdominal part of the aorta, it's called an abdominal aortic aneurysm that could form a pulsating mass in the abdomen. It is a very dangerous condition that gets bigger over time and could burst, causing life-threatening bleeding, which leads to major complications and a high mortality rate. But hey, this condition has risk factors that increase its likelihood. If you know it and try to avoid it, you can reduce the risk of contracting this disease. In this video, we will explain to you everything related to this serious condition, its causes, symptoms, and how it is diagnosed, in addition to the cases in which surgery is resorted to. Our role today is to answer most of your questions regarding abdominal aortic aneurysm. Today we have Doctor Gwon, who is a leading doctor at Korea University Anam Hospital. He is going to discuss with us everything about abdominal aortic aneurysm from an experienced medical point of view. Before we start, please subscribe to our channel so the next time you'll be updated with our new releases. So, moving on to abdominal aortic aneurysm, is it right?
Yes.
So what is it exactly and what kind of disease is it?
As the name of the disease suggests, it is a disease in which the aneurysm and blood vessels of the aorta passing through the abdomen swell. It is called abdominal aortic aneurysm.
Okay, the mechanism of development, what is it?
The mechanism by which blood vessels swell is because the walls of the blood vessels weaken. There is a constant pressure in our blood vessels. When blood pressure is measured, there is some pressure in the blood vessel, such as systolic blood pressure is 130, which presses the weak part of the blood vessel and causes the blood vessel to swell.
Talk to us more about the causes of this disease.
The most common is the degenerative change. Degenerative change weakens the blood vessel wall and causes blood vessels to swell. In addition, infection is a cause of weakened blood vessels. When blood vessels are infected and inflamed, or when the blood vessel wall is genetically weakened due to a connective tissue disease, the arteries swell and aneurysm occurs.
Okay, so I think it might have a lot of complications. What kind of complications?
The scariest complication is when blood vessels swell and burst. If a blood vessel bursts, it can be considered an emergency unconditionally. The second dangerous complication is that the blood flows through the swollen area, resulting in turbulent flow, which causes thrombus. Thrombus occurs in aneurysm, and later this thrombus goes down towards the end of the body, causing embolism. An embolism can cause dangerous complications such as neurosis of the lower extremities.
So we talked about complications. Are there any symptoms that shows early on?
In both arteries and veins, swelling of blood vessels does not cause pain. Therefore, many patients come to the hospital very late in their discovery. When a patient is lying down or relaxed, he or she feels something swelling in his or her stomach, and when a mass is touched, it can be identifiable and feel symptoms.
Okay, if after diagnosis, what is the diagnostic and the methods of treatment?
Like other vascular diseases, CT angiography is taken to determine the shape and size of blood vessels. In treatment, there is a way to cut out the swollen area of the blood vessel. And another way is to insert a stent so that the blood flows only into the stent and does not flow into the vessel wall.
So what do you suggest as a prevention of this disease?
Since it is a disease in which the blood vessel walls weaken, blood vessels must be strengthened. Blood pressure, diabetes, hyperlipidemia, and smoking are the 4 biggest risk factors for blood vessels. It is important to prevent this risk factor in advance.
Great, thank you so much, doctor. Today we learned many things about abdominal aortic aneurysm, and the doctor explained in detail everything related to its causes, symptoms, how it is diagnosed and treated. Thank you for joining us once again today at Cloud Hospital TV. If you have any questions or comments, please leave them below and we'll respond to you as soon as possible.